FastTrack ማለት ከእናቶች ጋር ስናያይዘን ነፍሰ ጡር እናቶች
FastTrack is a working method for making sure that large numbers of pregnant mothers are accessing PMTC service within a short time, which is within 90 days. In the past, the service given to prevent mother-to-child transmission of HIV was only given for those who come to the health center. But in FastTrack, the objective is to make sure more pregnant mothers can access the service, both at the health post and health center level, within the 90 days. When we see how it works, there are two teams in the FastTrack called Access and Quality teams. The Access team includes voluntary committee health workers, health extension workers, health extension supervisors, and people from the Warada office. That is the Access team. On the other hand, Quality team includes all technical professionals working with mothers and children, including the health center aide. It involves professionals working on PMTCT, working on mothers, children, working in delivery rooms, and also people from the pharmacy and laboratory. Members of this team are technically involved in providing quality PMTCT service and are those who can have an input for the quality of the service.
ምንድነው የመጀመሪያው የነበረን ፕሮግራም አንደኛ በቀበሌው ውስጥ
The first thing we did was to call a meeting with Kabale officials, EDR officials, religious leaders, community elders and other respected people in the community. We told them an organization called Clinton Foundation came here to work on preventing mother-to-child transmission of HIV, which is very important service for our community to build healthier generation and ask for their cooperation. We did the same thing in all our kabbales and the people were positive to the idea. Right after we got the go-ahead from these people, we started teaching in order to convince the community. While doing this, we mainly focused on areas in our communities that we think are highly exposed to HIV. These are mostly areas where prostitution is practiced, where drivers and single women who come from the rural areas stay, and where most of the daily laborers are living. Because we focused on these high-risk areas, we were able to find those we were expecting and targeting.
FastTrack መጀመሪያ ላይ ያው ስልጣናውን ወደን ስንወስደው በጣም ክብደት መስሎ ታየ.
When we first heard about FastTrack, we thought it was going to be tough to implement. I was afraid of rejections and negative attitudes from the community when trying to convince pregnant mothers to come to health centers to get tested for HIV. But after getting the go-ahead on the meeting with elders, community, and religious leaders, I was certain that convincing the rest of the community would be an easy job. Without these kinds of approvals from the community, entering people's houses and talking to them would have caused problems. But after getting this approval, I started working on my part the following Monday.
Right after we finished the training on FastTrack, the first thing we did was registering pregnant women in our community to know the exact number of pregnant women. Then we started sending these pregnant women to the health center in order to prevent mother-to-child transmission of HIV. For those who were willing to get tested, I wrote a referral slip and sent them to the health center. For those living in a large village located far from the health center, we organized an outreach testing program by communicating with the health center. We told them the number of pregnant women in this village and requested for a health professional to come on a certain date to a specific location. Professionals would come on that specific date a location and conduct the test. This way we were able to test all pregnant women.
ነፍሰ ጡሮችን በነቂስ ያስመረመረ ጸረ ቫይረስ ህክምናውን በማግኘት ወደ ጽንሱ እንዳይተላለፍ የሚረዳትን ህክምና
This means by getting this service a mother can prevent the transmission of the virus to the child. We will discuss in detail what an HIV positive mother should do and what an HIV negative mother should do after you give the blood samples. These mothers seated behind me are here to get PMTCT service in an outreach program we organized. The main objective of this outreach program is to provide the PMTCT service so that a child free from HIV can be born. The main goal of this kind of interventions is to provide access to the service for those who can't travel or walk to the health center. That's the reason we are here at this ቀበሌ.
አቅራቢያቸው አገልግሎቱን ለመስጠት ነው እዚህ ቀበሌ ድረስ የመጣነው። አጋጣሚ የቀበሌ ቅጥር ሰራተኛ ነኝ። ቅጥር ሰራተኛ በመሆኔ ስራው ማብሮ የተሰጠኝ ስራ ማብሮ ይጋብዘኛል። የሚጋብዘኝ ምንድነው? ቢያንስ
Fortunately, I am an employee of Kabale, and my job provides me the opportunity to go house to house. When collecting rent fees for Kabale or when enforcing something, I usually reach many houses in the village. So side by side, I work with the pregnant women.
እነዚህን ሰዎች ከዚያ ስራዬ ጋር ጎን ለጎን ነው የምሰራቸው።
ነፍሰ ጡሮችን ፈልጎ በማግኘት
I can say the reason why I am successful at tracking pregnant women is because of my past involvement in many health-related activities. The community recognized me from the work I have done when we faced epidemics and from my active involvement in different prevention interventions. Due to these facts, people tend to be more open with me.